There has been concern around the world that a more infectious variant of COVID, first identified in India, could be spreading. And it's this variant that's worrying Victorian health authorities.
An outbreak of the so-called Indian variant, known as B1617, has hit Victoria. It's the first time the Indian variant has seeded by community transmission in Australia. Genomic sequencing shows the outbreak is linked to a breach in hotel quarantine in Adelaide. It's severe and highly infectious and has spread to dozens of countries. A recent UK study found AstraZeneca and Pfizer vaccines are highly effective against the Indian variant after 2 doses.
Dr Rob Grenfell is Director of Health and Biosecurity at the CSIRO, and he joins me now with more from Melbourne. Good afternoon and welcome to you.
Good afternoon, Kirsten.
How critical are the next 24 hours in determining whether Victoria is in fact ring-fencing this latest outbreak?
Yes, I guess the encouraging signs are that of the 160 or so close contacts of the cases, 80 of those have come back negative. That's great news, but I guess they'll be giving us some more news later on today about the results of some of those other test results. So I guess with case tracking, what they're looking for are the central core cases and then their immediate contacts, and then also the additional testing of those in the so-called next tier. And if we do get positivity in that next tier, that is of great concern, which means there may have been breaching into the broader community. So yes, the next 24, 48 hours is critical to see that we've actually got this under control.
Are you feeling unsettled because we are talking about the Indian variant being seeded in the community for the first time here in Australia?
Well, certainly the variants of concern, of which this Indian one and the other UK and the South African strain have all been ones that we've been watching how they've affected other countries globally. We're reassured by the UK experience and their published results on how the 2 doses of AstraZeneca or 2 doses of Pfizer are in fact actually good at controlling this variant. But as you know, we're not immunised enough in this country to control this. So I'm concerned that if this variant does actually breach our control lines, we may find ourselves with a much bigger outbreak.
What is known about the variant in terms of its reproductive rate and indeed whether it may actually provoke different symptoms in people who actually do end up coming down with COVID-19?
Well, there's certainly some indication that it may not actually have exactly the same clinical ramifications of COVID, but COVID itself does have quite a varied number of clinical presentations. The usual is the sore throat, cough, fevers, sweats, aches and pains in the muscles, but there can also be a predominance of nausea, vomiting or gastrointestinal upset, so it can be quite varied. There's reports that there may be more towards the gastrointestinal with the Indian variant, but again, we don't have a full picture on how different this may be to the others. As for reproduction rate, the UK is sort of talking about a 50% more infectious rate of this particular variant.
Now, of course, Victorians are anxiously waiting to learn whether they might be subject to another lockdown. Do you think for right now and where Victoria is at in terms of this stage of the outbreak that the restrictions announced so far are enough?
Well, until we understand exactly how far this has spread, because I guess where we were, believe it or not, to the day this time last year, was we had 3 separate outbreaks and 3 separate clusters, and they were cut much larger at that stage when they were discovered. And then we had that enormous long lockdown here in Melbourne to actually bring it under control. At this stage, we have a cluster of 15 definite cases, and probably there'll be a few more that will be picked up over the next 24 hours, but hopefully they're in the close contact realm, because all those people are now actually quarantined. And I guess in one sense, these controls at this stage are probably appropriate to in fact actually determine or at least look at the control of this. But if there is other community spread, unfortunately I guess there'll be announcements of moving into further control measures.
Are you surprised that as of this morning Victoria's Parliament wasn't using the Service Vic QR code?
I wasn't aware of that the fact that they weren't doing that, but I guess there's been, as you'd be aware, a crackdown on facilities using the QR codes across there, and there has certainly been a lot more scrutiny that's been applied. And it's been a very helpful tool for case trackers to actually find and work out where particular exposure sites might be and for how long they might be. So it is something that actually has been a great tool through this.
We are expecting to shortly learn the results of the inquiry into the leak at South Australia's Medi Hotel, which in fact led to the outbreak in Victoria. There must be immense interest in Victoria as to the results of that report. If it indeed finds that aerosol transmission was the cause of the breach at that hotel, do you think we'll be talking again about whether the quarantine facilities we have at the moment are adequate?
Look, as we've seen this pandemic progress, we've seen the emergence of variants that are actually more infectious. Now, that's expected in viral behaviour. So, for instance, think about it this way. When you've got the infection, you're infected with over billions of viral particles. Now, if we're social distancing, the ones that are favoured in spreading to somebody else are those that are actually more transmissible or infectious. It's not in the virus's interest to actually become more fatal, and that's certainly not what is necessarily a concern of us looking at the variants. But the idea then is put that into a vaccinated population, and you'll also and social distance, or an inadequately vaccinated population, and you'll see other variants start to step through. Or in the wild examples of spread that we're seeing now, say in Brazil or India, where many variants are starting to emerge. So you can see that it's a real milieu of in fact actually what's coming through. Now, with regards to aerosolised spread, we know that this virus is an extremely formidable foe. It is spread by aerosolised spread, and it's also spread by surface spread. Both of those are actually very important. And closed living contacts with poor ventilation do foster the spread. And as we find more infectious agents coming through, we will have to continually refine how we actually look after people who are positive to this virus.
Just finally, there is now a lengthening list of exposure sites in Victoria, a number of venues which clearly involve people who have returned to their home states. Do you think it is likely that there are other chains of transmission out there that we are yet to detect?
Yeah, look, it's possible. I won't say likely, it's possible. Again, I urge anybody with any symptoms whatsoever to be getting tested, because it's only through the general public's cooperation that we'll be able to find any of these potential trains of transmission, whether they're further throughout Victoria or in fact actually interstate. And again, you can't overemphasise that. If you've got symptoms, isolate, get a test and wait till you've got the result before you in fact actually start mixing with other people.
Great to speak to you, Dr. Rob Grenfell, Director of Health and Biosecurity at the CSIRO.
Thank you.